Hi, this is Dr. Alahi, and I'd like to introduce to you some very exciting, groundbreaking, randomized control study with respect to the treatment of dementia with a novel device such as transcranial magnetic stimulation. So, we all believe in evidence-based medicine, and this is one of the most important articles that has been produced. This is a proof of concept study, which was followed by a randomized study. This was submitted to the Journal of Neurotransmission in 2011. This talk is primarily dedicated to reviewing this study and for primarily clinicians or scientists. If you are a non-scientist or non-clinician, it may be hard for you to understand some of the terminology, but I believe you will still benefit. So what they've done here is they studied patients who have signs and symptoms of Alzheimer's disease according to the DSM-4 criteria. In summary, the ages range from 55 to 85, MMSE score of 18 to 24, and a CDR score of 1, which means that they're at least somewhat disabled. And they excluded patients who've had any serious unstable medical conditions, alcoholism or drug abuse. So they've done MRI scans on these patients to identify 6 cortical regions known to be involved in Alzheimer's disease. So most neurologists and neuroscientists know and recognize Broca's areas, Wernicke's areas, and now the dorsolateral prefrontal cortex, the parietal somatosensory association cortex. These are all areas that degenerate and show signs of atrophy on MRI scans. And then they actually placed these patients into a device that can transmit small electrical shocks through the TMS concept of transcranial magnetic stimulation. And these are the parameters that they've used. I don't want to go into too much detail, but basically they stimulate 3 regions per day at the following protocol. And what they also did is performed several cognitive tasks as the patient is undergoing the TMS. And what they found was absolutely remarkable. So before I talk to you about the results, the assessments tools that were used were exactly the same kinds of tools that were used in the pharmacological studies of these treatments for Alzheimer's, such as you may have heard of Aricept or donepezil, Exelon or rivastigmine. And these are ways that you can assess someone's memory, visual spatial skills, executive function, and such. And they also examined their depression. There should be an L in here, Hamilton Depression Scale. And so these are standardized treatment or assessment tools. And so they finally came up with approximately 12 patients. And they found that at the end of the 6-week treatment, there was at least a 4-point improvement in the ADAS-Cog score. This is absolutely remarkable. In comparison, donepezil or galantamine, those medicines that are currently being used, did not actually show much improvement. They may have shown some reduction in the rate of decline, but not nearly this much improvement in such a short span of time. So these are absolutely remarkable. And just to give you an idea, this is a very common tool that we use, the mini mental status exam, to evaluate patients with Alzheimer's. And as you can see here, the lower the score, by the way, means the improvement, meaning that the patient is less severely affected by the dementia process. So at 6 weeks, you see a significant improvement, and then this improvement persists even at 4.5 months. So a common question I get is, how long will the improvement last? Well, this is remarkable that for a neurodegenerative condition that shows progressive decline, you have persistence of improvement even at the 4.5 month mark. So again, also improvement in the CGIC. This is the global impression scale of clinicians evaluating their patients. And the lower the number, the better. And so they, at 4.5 months, they show significant improvement. Basically, this is someone who's totally disabled, now being able to conduct some activities on their own without significant assistance. So this is absolutely remarkable. This was followed then by a double-blind randomized control study, and again submitted to the Journal of Neurotransmission. Very similar, if not identical, exclusion and inclusion criteria. And the only difference here is they randomized the group into a placebo versus an active arm, which is one of the gold standards for evaluating patients with dementia. The results were absolutely remarkable. Once again, we see in the treatment arm a significant improvement of an average of 3.76 points in the treatment arm, whereas in the placebo there was hardly 1 point of improvement. At 4.5 months, there was a 3.52 improvement, so again, persistence of improvement, whereas in the placebo arm, in fact, they continue to worsen, which is what is expected in patients with dementia. The global impression of change clinically showed a significant improvement as well, whereas in placebo, in fact, if anything, they worsened. So anything above a 4 is signs of worsening. So these are absolutely remarkable. The results were superior to that obtained by medication trials. And if you compare cognitive therapy alone, meaning if you sit with patients or neuropsychologists or others do these quote-unquote brain games, you get less than 2 points of treatment. But when you combine this kind of treatment with TMS, you get, again, these results up here. A significant improvement in comparison to the control arm. So the theory behind TMS is that it causes enhanced synaptic plasticity. There's a concept called long-term potentiation of synaptic signals, which means that there's increased excitement, or if you will, excitatory potential for transmission of neural activity. And we see on fMRI increased blood flow as well. So another study that was done with TMS in 2012, not too long ago, was submitted to the Journal of Neurology. And here they had 52 patients as the initial subject profile. A little misspelling here. And they've done a CT or MRI, excluded these types of exclusions, such as previous history of stroke, metabolic disturbance, and they assessed with these tools the mini mental status exam, instrumental daily living activity. And so there's 3 groups. One had 20 hertz stimulation of the dorsolateral prefrontal cortex. Another had continuous 1 hertz over bilateral DLPFC. And the third group was sham, meaning the coil was elevated away from the head and there was no actual stimulation. Results, again, completely remarkable. Significant improvement. So let's go through these. In the first group, which is the 20 hertz stimulatory protocol, the before session MMSE score was 18.4. In this case, the higher the number, the more healthy the patient. And after the last session, they improved by at least 3 points. In 1 month follow-up, they continued to, in fact, improve to 22.3 on average. And again, at 3 months follow-up, they continued to persist in terms of their improvement in comparison to baseline. And this p-value is a statistical number given to whether something is in fact valid or a result that can happen by chance. Any number below 0.05 is considered significant, and this is absolutely significant. In the 1 hertz and in the sham group, they were not significant. So this is an excitatory protocol, which means that it does excite neurons. So again, in another assessment tool, the IADL, which is the Instruments of activities of daily living, patients improved 4 points, which is absolutely remarkable. You will not achieve this with any type of medication in such a short span of time. To look at this in graphical form, Group 1A showed the biggest improvement. That's in fact the group that actually had the 20 hertz rTMS. And then the changes in mean of geriatric depression scale. So here, the lower the number is the better. And Group 1A, in fact, showed the biggest decline in depression, in the depression score. So not only do you have improvement in memory, but you also have improvement in mood. These findings are absolutely remarkable. You can actually see the actual papers if you like, and actual assess remarkable achievement in the area of dementia. We have this tool here at NeuroSpa Brain Rejuvenation Center. We are more than excited to apply this type of treatment to patients who are suffering from dementia. Please feel free to call us at 949-652-7301 or visit us online at neurospabrain.com. Thank you.